bones, right? Whenever we're palpating, what 3 bones make up the ankle joint? Calcaneus. Okay, that makes up the subtalar joint.
Okay.
What else? What makes up the talocrural joint? Talus, fibula, tibia. Good. So that's always a good place to start. So you want to always start with palpation. You want to start away from the site of injury and work towards. If I'm doing tibia, tibia is on the medial side. I just work all the way down the bone until I get to the medial malleolus. So remember, medial malleolus is part of the tibia. Remember those Ottawa ankle rules? So the posterior portion of the medial malleolus is one of those spots on the Ottawa ankle rule, so you can palpate that. Fibulas on the lateral side, you can start all the way up at the fibular head and work your way down all the way to the lateral malleolus. And again, the posterior part of the lateral malleolus is part of the Ottawa ankle rules. So you can palpate that, and you can palpate the whole malleolus. The talus is actually pretty difficult to palpate because it is deep in the joint, but you can still try, so just try to relax your foot. Basically kind of put your fingers in between the 2 malleoli and palpate in there. Okay, so that would be talus. Daryl said calcaneus. So calcaneus is your heel bone. You can kind of cup it like this. You can palpate the whole thing like this. Okay. And then you can move into the feet and the other talar bones. So you have like your base of your fifth, remember, is another Ottawa ankle rule. So you can palpate that on the lateral side. You can palpate the navicular, which is your bump on the medial side. That's part of the Ottawa ankle rules. And if you want, depending on where the injury is, you can palpate all the cuneiforms, the cuboid, in the foot as well. Okay, and they're all in here. Any questions about those? Okay, so then what's next after our skeletal? Articular, good. So what kind of things would you be palpating in the ankle for articular? Deltoid ligament, good. So that one's on the medial side. If you find where the medial malleolus is, it's basically inferior to it. So you can palpate it along just beneath the medial malleolus. What else? So we got deltoid ligament. Yeah, PTFL, posterior talofibular. So that's at the back, so it's back here. Remember, these 3 ligaments are at 3, 6, and 9. So this one's at 9 o'clock. Calcaneofibular is at 6 o'clock, right below the lateral malleolus, and then ATFL is kind of like at 3 o'clock. So right in here. Okay, good. Anything else for articular in the ankle? You could palpate the subtalar joint, which is pretty deep, hard to palpate as well, but it's basically kind of right along where the calcaneus and the talus meet. So like right in here. Tender in there? And you can do that on both sides, the medial and lateral side. Okay, everybody's good with that? And we'll move on to muscles. What muscles are in the ankle? What muscles act on the ankle? Gastroc, good. Remember they're in 4 compartments. So your gastroc is in your posterior compartment. What else is in that compartment?
Soleus.
Soleus, good. What other compartments do we have? Anterior, good. What's in that one? Tibant, good, is the main one, and then you have your other toe extensors. Okay, what other compartment? Lateral, good. What's in that one? Peroneal muscles.
Brevis longus, right? Is that right?
Yeah, usually brevis and longus, and then tertius would be included in the anterior compartment. And then what other compartment? Deep, posterior. And what's a muscle in there? Your toe flexors and tib post. Good. So just because she's in this position, I'll start with the anterior compartment. So basically that kind of runs along the lateral side of your tibia. So you can feel this muscle bulk in here. That's mostly your tibant, but as well as the toe flexors. Or sorry, toe extensors. It comes all the way down here. The tib ant comes along, this is her tib ant tendon, and attaches onto the navicular. So that's tib ant. Lateral compartment are your peroneals, and they start up near your fibular head, just a little bit below it. And they are often rope-like Beth's right here. She's got a nice little rope there. That's along the lateral side of your ankle or your leg. And then they do come, your peroneal tendon is right here, comes and attaches on the base of the fifth. So this is all peroneals here. Okay. Any questions about those? Tib post, so that's a deep one. It is pretty hard to palpate. The one spot you can palpate though is if you feel right on the medial side of the tibia. So you have to get pretty deep. You're deeper than her calf muscles. You're like in here. That is her tib post. Okay, and it runs all the way along. She's pretty tight, like right there, it's pretty tight. And it comes down through here. Remember this tarsal tunnel we talked about? There's 3 muscles that run through there, Tom, Dick, and Harry. So tib post, digitorum, or flexor digitorum longus, and flexor hallucis longus. All run through there. Okay. Everybody's good with those ones? Then to do the posterior compartment, I'll get her to roll over onto her stomach. And so gastroc is the big juicy one, the big one that forms your calf, the shape of your calf. So it's right along here, and then it comes down and becomes your Achilles tendon. Achilles tendon is also something you always want to palpate. If they have any issues with that, they'll usually be tender. So palpate the Achilles tendon. Soleus is flat and deeper, so you have to get a bit deeper to palpate that one. And it's deeper than your gastroc. Remember, your gastroc too also comes up past your knee, so you can palpate the tendons at the knee as well, on the medial and lateral side. Okay, so everybody good with those? So that's ankle. Now, do you want to have the same model, or do you want to go write notes?
I'm fine.
You're okay to do the whole thing?
That's Laura.
Okay, me and Laura. Okay, then we'll move on to knee. So what bones do